Congressman Doug Collins, Vice Chairman of the House Republican Conference, with me out of Atlanta, Georgia. Sir, how are you, and welcome back to America's Newsroom.
Bill, it's always good to be with you.
I've got a lot to go through here. We'll see how much we get through. Would you have supported this in the end or not?
Yes, we were supporting it. It was good policy. We had been working on this for a while, and it was something that believed it would do exactly what we promised. That was repeal and replace and provide Americans the stability, but also the assurance to know that we are working to get rid of something that is disastrous on the American health care system, that's Obamacare.
Yeah, and you know your colleague Jim Jordan is very much against it, right? And your colleagues, your friends.
Yes.
He contends that only 17% of Americans even knew it was in the bill. I don't know how 17% of Americans would even know it's in the bill because none of it really was talked about. Is he right on that point?
Well, I think the biggest thing is making sure that the members of Congress knew what was in the bill, and those were things that we were working on, and Jim was very much of a part of that. So I don't think he was part of the 17%. I think he was part of the percent that knew what was in it. He wanted to work. He come to the table, and they were negotiations, and they were able to receive some things that they wanted. This is a part of legislative process. Did Jim
Jordan let you and your Republican colleagues, and in turn the president, down?
I think that's interpretation. I was disappointed we didn't get the bill to the floor, and I think that's the problem. And I think so at a certain point in time, I think we have to acknowledge the fact that we have divisions within our conference that we need to talk about and how that we can move forward with something that we've talked about. There were a lot of things that were very good that we've talked about for many years. This was not all of a sudden a new proposal out of left field. There were many things in there that many of us had already voted on or even had signed on to before. And I think it's really interesting for Senator Cotton to say we moved too quickly. I'm sorry, but the senator never worked on this in the Senate because we didn't get the bill to them. We were hoping to get the bill to them so that they could do the work that they're supposed to do on their side of the legislative house.
Let me get to Tom Cotton in a moment. It's an interesting point you make there. Jordan said it was not going to bring down premiums. Jim Jordan said it was not going to repeal Obamacare, and that's something he could not support.
Well, I'm sorry, we just have a disagreement. Jim's entitled to his opinion, and he's entitled to his voting card, and I'm entitled to mine. And I think as we work forward this, we were doing away with the mandates, we were doing away with the taxes. Those are the things that when most people think about Obamacare, those are the things that first come is a government forcing you to buy health care that you don't want, and especially under Obamacare, forcing you to buy health care that you can't not only don't want, but you can't afford in the end. So I think we're moving forward. The question is, and I talked to many of my colleagues, and most would have admitted that was the bill completely perfect in every way. No, but as I've said many times before, I have a yes, no, and a present button when I vote. If I had perfect, I'd vote for it every time. Yeah. What we understand here is, though, we moved. We did what we said we were going to do, and we were moving in the direction that we said. And when you have an 80–90% of what most people could have said that we could get at this point, we'll let the Senate do their work. Then it's time to move forward. That's just where we have a disagreement.
Yeah. Back to Tom Cotton. His quote was this: President Obama traveled around the country, held town halls, spoke to a joint session of Congress. Is that a suggestion that President Trump did not do enough in order to figure this out and complete the play, so to speak?
Well, it sounds like there is an implication that he didn't feel like the president was involved enough. He and the president need to have that conversation. But I think the interesting thing is here is for the last 7 years, members of our party, both in the Senate and the House, have campaigned on this disastrous Obamacare law. In fact, it is the reason in 2010 that many of the members of the House are in the House was because of the passage of the bill. And since then, we've been talking about this issue and trying to dismantle this piece of legislation. Since then, I believe we had an excellent opportunity to move that ball forward. There were some disagreements, which always occurs. The president was fully engaged, the House leadership was fully engaged, members were fully engaged, and we have disagreements. It ended up in a stoppage on Friday, which I believe was a setback. But this issue of the fact that this stuff was not discussed enough. I'm sorry. Maybe the senators didn't want to vote on it. Maybe that was the part that we're not dealing with here.
Last question. I'll let you go. Is this dead in the water now? And if so, what does it do to the campaign that you talked about for so many years?
Well, I think we're definitely in a setback. We need to decide which way we need to move forward. I think that those are the questions that the president is going to have to answer. I mean, many of us felt like this was putting forth a very conservative piece of legislation. I mean, Mick Mulvaney, Tom Price, members of the administration now, things that we had worked on. So we're concerned, I'm concerned personally, is that we move forward and we bring in others, Democrats or others who I don't think right now want to work on this law. It's not going to be as conservative piece of legislation as we could pass through for the American people. So for most of us, we're trying to say, what can we do to move forward from here, to answer the questions that came up on Friday, and to support the president and move forward to not only keep his promise, but to keep our promise as well. There are people hurting under this law. It is getting nothing but worse. And to simply say that we can't move forward is not something that I believe is attainable for this Republican Congress.
Let's leave it there. Sir, thank you. Doug Collins from Atlanta, Georgia today. Thank you, sir, for coming back today.